Namaste everyone. Thank you all so much for coming. So I'm going to invite Priya ji and Sarita ji to start us out with a prayer.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ॐ सहना भवतु सहनौ भुनक्तु सह वीर्यं कर्वावहै तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्ति.
Again, good afternoon everyone. On behalf of Board of Trustees, the Advisory Committee and the Executive Committee, I'd like to welcome you all for the third Healthcare Awareness event at HTCI. So those who might not know this, we have conducted an Expectant Mothers health fair event. We also conducted a heart health fair event, and now we are going to talk about diabetes, right? So one of the things I just want to kind of call out though is that HTCI is investing a lot trying to bring health awareness within our Indiana community. We have some great panel of doctors here, plus Sarita ji, who is a certified nutritionist. How do you say that?
I still do the same thing. We've been called dietitian.
Dietitian.
We've been called nutritionist. Now it's registered dietitian nutritionist.
All right, so that's mouthful to me. So that's the reason why I'm not going to talk about the details of the diabetes though. So I'm going to let the expertise here talk about it. And one thing though is that we are going to continue with this approach of trying to kind of bring awareness about various types of healthcare needs that the community might have. So with that being said, what I've been told is that by the world's most popular doctor and the most cheapest doctor, which is Dr. Google, said that the diabetes is very, very, very increasing. It's one of the most silent killers, and it's kind of on the rise amongst the Indians here in the US. So with that being said, I'm going to first start off by inviting Dr. Mahesh Goyal. And before I hand off the mic to Dr. Mahesh, I just want to kind of just mention a couple of things about Dr. Mahesh Goyal though. So how many of you know about HTCI clinic that's been run here in our temple? Right? So it's been run every other Saturday, the first and the third Saturdays, since 2017. Dr. Goyal is being the tireless and fearless individual who's been kind of spearheading the HTCI clinic. And Dr. Goyal is going to go into the details of the clinic in a bit, but I don't want to steal his thunder. But one thing, Dr. Goyal, thank you so much for your selfless seva, and you have been a tremendous asset for HTCI. We truly, truly appreciate it. And with that being said, I'm going to hand it off to Dr. Goyal.
So, सभी को मेरा प्रणाम एंड मैं आपका बहुत आभार व्यक्त करता हूँ कि आप आए यहाँ पे आपने अपना समय निकाला हिंदी इज ओके हिंदी ओके
Everyone is okay with Hindi?
सो आपने अपना समय निकाला और आप यहाँ आ सके
Joe needs English.
Okay. So you taken your time out and you could come here and be a part of our discussion and our lecture today. As Ravi has already told you that HTCI is taken a lot of initiative to start health and wellness lectures and awareness so that our community can understand the complexity and actually can help themselves to improve their health so that they are not dependent on the physicians and the medicines and all those things. This is a third lecture series today, as Raviji already told you, and this is our lineup. We have a great panel of experts here. You will be listening to the experts by their own voice, and you can have questions and answers. You can have direct interactions with them, whatever you want to ask related to these topics. We have Mahesh Goyal I'm Mahesh Goyal, and I'm a urologist and a kidney transplant surgeon. And as Raviji said, I have been doing this clinic for last 7 years now. And Priyaji, Dr. Priya Menon, everybody knows Dr. Menon very well. She has been a part of the community and part of volunteer and executive committee and so many other things. She has a lot of roles, and everybody, I think most of us know her very well. She's an endocrinologist. She works at Hendrick Regional System, and she is expert in diabetes. So she is going to speak and ask a lot of questions to her. Then comes Sarita ji. I am sure all of you know Sarita Vajpayee and Anil Vajpayee. This couple has done tireless work for the Hindu community, especially for this temple, as well as to all other activities. And Sarita ji is a dietitian and nutritionist, and she has a long background on her and experience with her. She is an expert in diet advice for diabetes, and you can ask her क्या खाना है, दाल खानी है, चावल खाना है, दाल भात खानी है, काठा दाल रोटी खानी है, आप नहीं से पूछिए क्योंकि मेरे को तो सब पसंद है. So I think I will stay away from that topic. Just listen to her. Dr. Dhananjay Kulkarni, he is a nephrologist. Nephrologist means a person who deals with the kidneys, kidney failure, dialysis, and he is going to discuss on diabetes and how to prevent or stabilize your kidney function for long run, especially for those people who have diabetes. Dr. Murthy have not arrived yet, but he's going to come. He's a specialist for retina, and uvea is a highly specialized ophthalmologist. You don't see these people that often. Taking an appointment from a retina specialist will take you 6 months. So he will be here, and he's going to speak on diabetic and healthcare. Dr. Natarajan, he will not be able to make it today. He's an interventional radiologist. So this is all. First one is Dr. Sarita Vajpayee. He's all coming. Yes. Dr. Murthy. Third one is me. Dr. Dhananjay is sitting right here, and Dr. Menon is right there. They are going to come and speak. This program is basically organized by Hindu Temple of Central Indiana in liaison with HTCI Medical Clinic. I will just say a few words about clinic and then hand over the mic to the experts. So this clinic, actually I feel proud and honored to say that we started this clinic, and actually I am one of the founder members. Other founder member is Anil Vajpayee. He was the president when he came one day to me and we started discussing it, and you will not believe it that the clinic started within 6 weeks of our first discussion. And that clinic has been running since then. We have faced a lot of resistance and a lot of, you know what, and but still the clinic runs, and it has run. In last 7 years, we could not open it for 2 days. And that is what is, one day it was, I think, heavy snow, and then one day there was some problem, some communication problem. Otherwise, we have done it 7 years without stopping. Right now, it's on the first and third Saturday. First Saturday is a virtual clinic, so usually I or one of us will give you a call if you need any help. On third, one of our doctors is here. Usually it is me or my wife or somebody else will be here to take care of you. If you need a prescription will be provided. If you need labs or you want to go to imaging, we have set up with the people who are very cost effective. Sometimes it might be more cost effective than going through the insurance, I can tell you that. Beneficiaries, who can be the beneficiary? Anybody can come. This clinic is a free clinic, does not mean that we are only for people who are not insured. I just want to make it very clear. Anybody who is insured or not insured can come and take the services from us. Many students come here, many parents come here, and I have seen people coming as far as St. Louis just to come to this clinic. You will be amazed to know that. We take in walk-ins, you can come in between 9:30 and 12:30. Normally, last patient we take is at 12 o'clock. So you should come between 9:30 and 12. Any of these Saturdays on virtual, give us a call. On virtual, you just send us an email and one of us will give you a call. And for in-person, you can come in anytime on those days. So other than just medical care, what clinic has done, and I really feel proud to give you this information. So we take some of the students who have done MBBS or other things and who come as a wife or a partner to other people, and we have taken those people, volunteers, and who have done a very good job with this clinic. And you will not believe that 3 of those volunteers, we could place them into residency programs. During COVID, we were like just silent. Nobody, you might never heard of our name. I myself have provided hundreds of prescriptions to the parents, the people and relatives who were stuck here, and they were running out of their medicines. And the problem is, none of the white guys or the guys who is in the system, even our own guys, will not feel comfortable to give you a prescription, because it's not that they don't want to do it, but the reason is there are limitations. If somebody is working for a Hendrick Regional Hospital, they have to follow the rules of the Hendrick Regional Hospital. She or he cannot just do it. So even if she is saying no, does not mean that she doesn't want to do it, or he doesn't want to do it. I should not take anybody's name, but there are limitations. That limitation, we do not have those limitations. But definitely, this is not a clinic for pain prescription. We do not provide any prescription for pain medicine. There's a lot of opportunity here for externship, and especially aspiring medical graduates or pre-medicals. They can contact us and they can come as a volunteer, and then the services are available. I'm not going to take too long a time. I see Raviji already looking at the watch, so I think better walk out from here. So I will invite Priyaji to come in here and then start on her topic.
Thank you, Maheshji. Well, thanks everybody for taking time on a Sunday afternoon to be here, and thank you HTCI for inviting all of us to speak on this very important topic of diabetes. Take a good look at the person sitting on either side of you. The reason I say so is they or somebody in their family, one of those 2 people will have diabetes, and if they don't have diabetes now, will develop diabetes in the next 3 to 5 years. According to the enhanced data, about 20% of Asian Americans have already had diabetes, and another 32% of people have pre-diabetes. They're waiting in the wings to become diabetic. So what that means is 1 in 2 households of Asian Americans have diabetes, or they're going to become diabetic very, very soon. This is not just in America, but if you look at India, 1 in every 7 diabetics in the world resides in India. 1 in every 3 households in India have diabetes. Can we advance the slide, please? For your reading pleasure, I've just put it all out here. But this tells us why we are talking about this. Why is diabetes so important? What is the scope of the disease? Next slide. What exactly is diabetes? It just means when you check your blood sugar, it is high. And what is high? If your blood sugar is below 100, you are considered to be in the normal range. When you are above 100 in the morning, we are talking about fasting blood glucose. If it's between 100 and 126 milligram per deciliter, then you are considered pre-diabetic. And if it is beyond that, if it is beyond 126, you are then considered a full-blown diabetic. If you look at it in terms of A1Cs, which is an average of what your blood sugar runs in the last 3 months, these are numbers that denote whether you are diabetic or not, or whether you are indeed pre-diabetic. If you don't have any diabetes, your A1C will be less than 5.7. Between 5.7 and 6.5 is pre-diabetic, and beyond 6.5 is diabetes. So get your A1C checked just like they did at the temple a few months ago. During the cardiology seminar, many people suddenly discovered that they were diabetic or pre-diabetic. Advance, please. we're now going to talk about the different kinds of diabetes. Diabetes happens because the pancreas, which is an organ in your abdomen, is no longer making enough insulin for your needs. And the result of that is when you check your blood glucose, it is high. If your pancreas is making no insulin at all, that is called a type 1 diabetic. Often that happens because you encounter a viral infection and your body is making antibodies against that virus and recognizes some proteins in the pancreas as similar to that they see on the virus. And therefore it turns around and attacks the pancreas. If the pancreas is wiped out of its cells that make insulin, you then have no insulin making capacity and you're completely dependent on insulin from outside. That's the last I'm going to say about type 1 diabetics, because it is a minority of of all diabetics. Only a very small percentage have type 1 diabetes. Most of them, the vast majority of us sitting in this room and outside, have type 2 diabetes. It usually affects older adults, maybe 40 years and older, and it happens because of two reasons. One is genetics. Again, I'm going to spend very little time talking about genetics because it is not something we can control yet. The first reason is we may be born with less number of cells making insulin. Everybody in this room is born with different number of cells, but we all lose cells at the same rate every year. So somebody who's born with 40,000 cells doesn't care because death will intervene before they become diabetic. But somebody who's born with 400 cells, they're panicking because they don't know whether in the next 10 years they're going to have less insulin making capacity that will render them diabetic. In other words, if all of us live long enough, we are all going to become diabetic. There is some, I guess, job satisfaction for me, or some way to keep me.
Yeah, it's working.
It's working, right? Okay.
I can hear.
Okay, great.
There's another microphone if you need to.
Here.
But I think-
No, this is good.
Yeah, try.
The light went out. Okay, I think it's working.
Here.
No, it's working.
Okay, so that is the first genetic reason, that you're having less insulin making capacity than your counterparts. The second reason why you become diabetic is what you do to yourself, environmental causes. In today's world of 24/7 supermarkets, you can go in and get whatever you want, whenever you want. Food is readily available all around you. The consequence of that is that we develop visceral fat around our organs. The more we eat, the more we deposit these fat cells around our organs. The more we have fat cells, the more insulin resistant we become. That means our own insulin cannot work properly. What is the job of insulin? It is to carry the blood glucose. When we eat something, it's converted to glucose for energy, right, in our body. That glucose, some of it we burn because we are walking, talking, breathing. Our heart is beating and we use that energy immediately. What we don't use is stored as fat. So insulin is a carrier. It carries our blood glucose from the bloodstream to the organs, and it encounters a door, the door of fat cells, which doesn't let it enter. And what it does is that it goes back to the pancreas and says, listen, I can't do my job. Can you give me more insulin? And the pancreas gives more insulin. So now you have a lot of insulin taking the same amount of glucose all the way to the organ, pushing open the door and storing glucose as energy for later use, right? This can only go on for so long. If you look at the army, they don't deploy all their troops at one time, right? If everybody is working, they won't get rested, and the cells will now die at a faster rate. And so you are now progressing slowly from not being able to store all your glucose. It does what it can, and then the rest of it, when you check, you see those blood sugar levels rise above 100 milligram per deciliter in the fasting rate. I hope the pathophysiology of the disease is somewhat clear. Next slide, please. Prevention of diabetes. This is, I think, what everyone is interested in. Can I prevent this from happening to me? For type 1 diabetes, unfortunately, there is not a lot we can do. There's no lifestyle measure that can help a type 1 diabetic. because you just have no insulin at all. But if you know somebody who has type 1 diabetes, or tell them that their children or their first degree relatives should get checked out for antibodies. If they are antibody positive and their blood glucose is not high, right now, as of last year, there is a new infusion called T-Zield. Infusing with T-Zield will help delay diabetes by 1 to 2 years. So it's not going to prevent you from having diabetes, but it's going to delay the onset. If you have ever seen a 2-year-old child with type 1 diabetes, you will realize how important this delay is. Pancreatic transplants and kidney transplants are available, but they are not very successful. So we don't usually get pancreatic transplants for type 1 diabetes unless they are uncontrolled and have bad kidney disease along with low blood sugar. You have to have all of them, because the response rate or the success rate of a pancreatic kidney transplant is only less than 30%. And so we don't do much. But type 2 diabetes, there's a lot you can do. The majority of it, prevention, will come from Saritaji's talk. What you can do with what you put in your food. If you put less glucose in, your own insulin may be able to do the job. What about lifestyle? Next slide, please. The physical activity. I'm not asking you to run a marathon. You could, but, if you could do 150 minutes a week, 30 minutes every day. And there are some really nice yoga poses that will help stimulate your pancreas and will help you make more sensitive to the actions of insulin. I particularly like, you don't have to do the full Bhujangasana, but any degree of Bhujangasana is good. So is Trikonasana and Gomukhasana. But all these asanas, Paschimottanasana, almost everybody can do it. You don't have to reach your feet, even if you do partway. Vajrasana. If you can do these in the morning, it will help you be more sensitive to insulin. Next slide, please. HTCI, our kids are organizing a 5K walk and run on September 22nd. Please come, please participate. It's good for everybody, whether you're diabetic or not. Please support us. That's the QR code if you're interested in running, walking, or sponsoring. Next link, please. All right. Nowadays, we have many, many ways to check if we are diabetic. Gone are the days of poking your finger all the time, 4 times a day, to check what your blood glucose is. You could use small devices like these sensors. These sensors are now, this is the size of a dime. The latest sensor is the size of a dime. Sits at the back of your hand for 14 days. Checks your blood glucose continuously. This one sits on your abdomen or on your, on your arm, at the back of your arm. They can be used, next slide. If you look at that, so only one needle poke every 10 to 14 days, there is a continuous flow of data to your phone, to your cell phone. And you can tell, well, I just ate biryani rice, half an hour ago. Well, how did it affect my blood glucose? How did the samosa affect my blood glucose? You are constantly given data about the food you ingest and how you are, digesting that food. The third thing is the trend arrows. There are trend arrows. It tells you if your blood glucose is shooting straight up, if it's going up but at a slower pace, whether it's steady, if it's going downward, and if it's going straight down, which is also not good. Blood glucose less than 70 milligram per deciliter is not desirable. There are alarms as well for high and low glucose. Next slide, please. I'm sure everybody was waiting for this one. Supplements. Berberine, turmeric, cinnamon, Yuva, Ursi. There's a lot of studies. Many of them improve insulin resistance. It's not that they don't work, but you just know how prevalent diabetes is in India. And which Indian household does not use cinnamon or turmeric, in their food? And despite that, we are going to be leading the world as diabetic champions, So if you look at the problem with these studies, they're small sample size. The dose of medication, some of these studies have 2 grams of cinnamon in them, 2 grams of turmeric. Who's going to have that much turmeric in a day? That's hard to do. There are different patient characteristics in different studies. The benefit, when they show a benefit, is modest. So don't go crazy buying supplements. The length of the studies are not standardized, and there are some of them show side effects. So be careful. Next slide, please. We have some traditional medicines. We usually divide medicines into cheap and expensive. Nowadays, we divide them into those that can cause organ benefit. How much time do I have?
You can take whatever time.
2 minutes?
2 more minutes.
Okay, all right. All the complications of diabetes are because of inflamed blood vessels. Why do we care about high blood glucose? It's just a number. Why do we care about it? We care because it can cause so much damage to your body. The blood glucose is like sandpaper. It makes your blood thicker, and when it runs against the blood vessel wall, it causes inflammation. It makes it red, raw, and angry. And when that happens, it can have a tear on the blood vessel wall, and therefore bad cholesterol can slip into that tear and coat your vessel walls. This is called a soft plaque. We cannot see it on a CT scan. This is very dangerous because it can break off and block your blood vessel. Over time, it becomes calcified, calcium deposits, and then we can see that on coronary calcium scans that everyone must have heard of. We can actually see it on a scan. By the time you have calcified plaques, the damage is already done. Think of a pipe with sludge in it. If you have dirt in the pipe, the blood flow to the organ that it is supplying is compromised. If it is closed off, like in the heart or the brain, you can have a heart attack or a stroke. If it happens in smaller blood vessels of the nerves or behind the eyes, or anywhere else in the body, it can burst. Or it can, worse still, it can go haywire and try to repair the damage in an uncontrolled fashion, which is also not good. So all complications of diabetes are the result of vascular issues, vessel problems. And now we have medications that are heart and kidney protective. I'll stop there and let you ask me questions. 5 minutes, yeah?
Yeah.
Okay.
Fine. 5 to 10 minutes.
First
Yes.
of all, great topic so far.
It was really amazing, thanks.
Thank you.
So, just quick question, I was googling some articles and so many Ayurveda people, they suggest that fasting or even long-term fasting with, like water fasting without taking any food, can help to lower down the sugar level. And they also support, on the basis of this water fasting, they also support ketosis. Rather than taking protein from carbs, they said from the inbuilt fat. Like I have a lot of fat already, so I can utilize this process if that is really suggestible.
Welcome to the club. We all have a lot of that. But, yes, intermittent fasting has been well studied and has been shown to be effective. You have to do it with caution though. If you're taking a medication that I showed in my prior slide, Jardiance, Farxiga, that group of drugs, you cannot be fasting for more than 24 hours. It's dangerous at that time. But if you're not on that particular medication, intermittent fasting really does help. What does intermittent fasting do? It reduces your caloric intake. So when you don't take enough calories, it breaks down your own fat process. Why do we do so much fasting? We as Hindus are very, very prone and we are well acquainted with fasting, right? This is ancient science. We devise a reason for fasting. But it's a good idea to fast. Every 14 days, taking a 24-hour fast is wonderful for your liver. It's good it will definitely help your diabetes for that day, But caution, don't, ketosis is good, but not for too long, and definitely not for type 1 diabetics. Type 1 diabetics should not be in ketosis. There is something called diabetic ketoacidosis that they are prone to. It will land them in the hospital. Anything else? Yes, please.
I just want to ask you that you told about the A1, the average diabetes. So you told below 6.5 is not diabetes and above 6.5 is a diabetes. So I just wanted to know if there is something like 6.7 or 6.9, will they still be a diabetes and can they come back to pre-diabetes?
Weight loss, weight loss, weight loss. The more weight you lose, the more insulin sensitive you become. You can move down the continuum from diabetes to pre-diabetes to non-diabetic. That is why some of these medications that help with weight loss, like, the once a week GLP-1s, I guess everyone's heard the name of Ozempic and Mounjaro that everyone's clamoring for. There are people who are just on that one medication. They were on 5 medications before, now they're only 1 because they've lost so much weight. But you could do that with fasting and lifestyle measures and become pre-diabetic. At least you would push out and buy time. Isn't that good? If you're 40 and you can push out taking medication till you're 60?
Thank you.
Hi. Thank you so much for all the valuable information. I have a question on the last slide.
Yes.
About
It's on, but keep it closer though. Keep it closer.
the green. It's on.
Yeah, it's on. Keep it closer to your mouth.
This is regarding the medicine choice between expensive and cheap. So I use metformin now. You recommend the other one, and how do I go about it?
If your insurance covers it at a reasonable cost, we always now try to use medication that have organ benefit. Always. I think Dhananjay will definitely agree with me that Farxiga is a wonderful drug for people with kidney disease. Anybody with heart disease, it will keep you out of the hospital and decrease the rate of heart failure, even if you don't have diabetes. So these drugs are incredible. We've never had an armamentarium like we have today. So please take advantage of these medications if you can. However, Medicare patients, they still, depending on their plan, they will still have to pay about $2,000 a year. And I'm talking about traditional Medicare plans. That's expensive. For some people on fixed income, that is expensive. So we use older, not as good medications like glipizide and pioglitazone that can cause leg swelling and worsen heart failure and cannot be used in heart failure and can cause some low blood sugar, hypoglycemia. Metformin is a good drug. It's weight neutral. Anyone else? I'm taking on too much time.
How to reduce the inflammation in the blood vessels?
Reduce the blood sugar level so that it doesn't get
So
sticky.
if I
and-
don't have diabetes, but I feel some inflammation around my body, so how do I control it and get to a better level?
I think this is a topic for Kananji, but I will take it. I'll take a shot at it. So, if you are absolutely non-diabetic, then inflammation due to diabetes is less. But hypertension, diabetes, and high blood cholesterol levels, these are the 3 ugly sisters. They do the same thing to your blood vessel. They pound it and then cause inflammation and will deposit themselves where they shouldn't be. They enter your home and destroy it, So if you have good blood pressure, good blood sugar, and good cholesterol values, I don't think you have much to be worried about. Okay? Yes.
Last question.
All right, go for it.
So, as you said, like according to you, the diabetes is reversible because most of the medical studies are saying with the